We're shifting focus now. We're going to do a bit of health, and we're talking about heartburns. What are they? That annoying thing that makes your heart feel like it's coming out of your throat, out of your chest. We're going to talk about that. And joining us is Dr. Oum-Kalsoum Adam. If you have any questions as we go along with this conversation, do send that to the WhatsApp number 0204 447 033. 0204 447 033. Doc, how are you doing?
Very well.
Catch your school for the say your way. It's okay. They are flooding our timelines. It's fine. It's okay.
We need to do it.
But it was lovely to see, though. You know, I saw my former MP, Dakwa Newman.
Oh, I haven't seen her.
Yeah, Dakwa Newman was part of the contingent. You know, she's a proud gay girl, always very. Of course, let me say a very big shout out to my sister. You know, my one and only sister.
Oh, nice.
You know, Hannah Siniba Tiga, aka Mrs. Fentuo. You know, I love you so much. You've seen the videos. It's okay.
Why are you taking it? It's okay. It's okay.
It's okay. You know,
no, it's not okay.
You know, it's okay. It's okay.
So, and then they'll go for their Thanksgiving and that'll
be it. You get it. You went to the second best girls' school.
Wait, hold on.
How is the second best?
Oh.
I mean, the first is mine, obviously.
Yeah, the first is
no, that's not true.
That's not true. Oh, no.
We are the standard.
The first is St. Louis. Simple. Thank you.
So,
you here all the way.
If you had mentioned another school, I'd have watched you off the set.
So, Anna, you went to the second best. In fact, third best, but you will give you because it's your duty. You know? So, shout out to all the gay girls. I have a couple of friends who went there. They are really, really amazing. You know? Yeah. And they are very smart. I think you can't take it away from them. Except that National Science and Maths quiz, no.
It doesn't get there.
I don't know. So wait.
Very
soon. Oh,
very
no
soon.
time. We'll start taking car very soon. No. Anyway, my school hasn't won some, so right. So,
I was about to say, but what are you fighting for?
Yeah, but we are a business school.
Don't use that as an excuse. Then don't join at all. Because it says science and maths. So why join if you're a business school? Anyway,
exactly.
Doc, how's your week been? That's
It's been tough. Yeah, it's been tough. We just ended the conference for the West Africa College of Surgeons. So
how did it go?
Well, it was a very successful event, but I ended up tired. After the event, yes, but it really went well. At least we had
the College
delegates.
of Physicians and Surgeons?
Yes, West African College of Physicians and Surgeons.
Wow. The
West African College of Surgeons. Yes, so basically, I mean, it's an association or a college for all surgeons.
So it's just like the one we have here, but
yes,
at the continent level, West Africa level, sub-regional level.
Interesting.
Wow.
Yeah.
I think we can go into our conversation now. Doc, what are heartburns, or what is a heartburn?
Okay, so a heartburn basically is a sensation that you usually would have just behind the breastbone. Usually you feel this burning sensation, and typically it often occurs after having a meal. Okay, so you feel that burning sensation. And sometimes it becomes worse when people lean or lie down soon after having a meal, okay? And that sensation usually stays on, and it's relieved by taking certain medications like antacids, okay? So that's what heartburn is. Sometimes there are certain signs and symptoms beyond the burning sensation, and we need to be able to tell the difference between what a heartburn, a typical heartburn is, and then how different is it from, let's say, a cardiac problem or a myocardial infarction. So to differentiate the two, you'd notice that for myocardial infarction or anything related to the heart is not a burning sensation, but you have this tightness within the chest. And aside the tightness, you may have other signs and symptoms like that sensation radiating to the shoulder, the tip of the shoulder or the neck or even the jaw. So you would be able to differentiate what a typical heartburn is and what a myocardial infarction may be as it is. and one is much more serious than the other, because this may be life-threatening as opposed to you having just a heartburn from, let's say, GERD. GERD is gastroesophageal reflux disease. That's typically what causes the heartburns that we have. So if you look at gastroesophageal reflux disease, it's so let's start from the basis. When you want to have a meal, when you eat, it moves from the mouth, it goes through a tube, and that tube is called your esophagus. Okay, and that tube leads you to the stomach, and then from the stomach it goes all the way down to the small intestines, large intestines, and then it goes on and on. So typically you have GERD or heartburn from GERD when you have, there's a sphincter. So there's a muscular sphincter, or let's say there's a valve that allows, it relaxes to allow for food to move from the esophagus into the stomach. And you know, we all know from even primary school that the stomach, that is where you have HCl or acid produced. And the acid helps with digestion. Okay. So when food gets from the mouth, it goes into the esophagus, through the sphincter, into the stomach. It's supposed to stay in the stomach for digestion to occur, and then it moves downwards. But you have GERD oftentimes when you have that sphincter being lax, or it's not as tight as it should be. So you have some backflow of the food and then the gastric content into the esophagus. And that is where you would end up with some burning sensation anytime this happens. So typically the patient would say that, oh, anytime I eat, shortly after eating, I tend to have this burning sensation. And then it tends to become it becomes worse as when I kneel or I lean forward or I lie down. Okay, so that's because it helps with the regurgitation or the backward flow of the food and then the gastric contents that tend to irritate the mucosa of the esophagus, and then you end up with that burning sensation in there. And it can be a little uncomfortable because people would have that and then it's actually recurrent. So if you do have it once a while, sometimes you see that, okay, maybe it was just some relaxation or because of some of the foods that you may have eaten that may have caused that. But GERD typically would be if you do have that burning sensation about more than twice within a week, then you can say that, okay, this may be a typical candidate for GERD amongst other signs and symptoms that the patient may present with. If it does happen once once a while, it could be as a result of certain foods that you may have taken. So typically you have chocolate, you have coffee, fatty meals. All of these do contain certain components that reduce the tone of this lower esophageal sphincter that I'm talking about. So that is one of the risk factors. You having or indulging in some of these foods, and because of that component within the food, it causes relaxation of this sphincter, and then you have the regurgitation with the burning sensation that you would have within the chest region. And the prevalence worldwide for GERD is about 12% globally. Okay, but when you look at it, when you come to Near East and African region, it's been, some studies have quoted about 33%, but that is dependent on different studies that have been done in different regions within the Near East and African sub-region. And then in Ghana as well, some studies, typically I think one in Wenchi, quoted about 12% of patients presenting with gastroesophageal reflux disease. So when it comes to the signs and symptoms, aside the burning sensation, which is one of the main symptoms that the patient will present with, there are certain symptoms too that may point to you having GERD. So one of them could be that because there is always upward flow or regurgitation of the acid when it gets to the mouth region, you may end up with something we call the teeth will be eroded. So there's something called dental erosions, and then the patient will come with sensitivity of the teeth associated with that. It could also be that if it goes all the way and then it goes beyond the upper esophageal sphincter, it can go and then irritate the larynx. Okay, so patients may end up with what chronic cough, or they may end up with what hoarseness of voice, depending on if it is affecting the vocal cords as well, or irritating it. Now, when it gets to the esophagus has a lining. Now, that lining is not strengthened to be able to withstand the acid that is produced, unlike when it goes to the stomach, because the stomach is where the acid is produced. So it is actually fortified with, or is strengthened with a particular lining that can withstand the acid production. But when it goes to the esophagus, you notice that it irritates it. So when it irritates it, it will lead to inflammation or edema, and that is also why you would have the burning sensation. So you would have that edema, and then if it happens and then it tones down and it happens again, it means that you may end up with some ulcerations. That edema can now transform to become ulcers. If these ulcers heal and then it recurs again, that means it will heal with some fibrosis. So it will heal with what? Scar tissue. So if it heals with scar tissue, then you end up with what? Some strictures or narrowing of the esophagus. So once that happens, it means that the patient may end up with typically presenting with the fact that I have difficulty swallowing. Now, usually how I used to swallow without any difficulty, now I have difficulty swallowing because of the narrowing of the esophagus. It can also progress to actually continually cause something we call Barrett's esophagus, where the epithelium of the esophagus is replaced by another epithelium just to be able to withstand the acidic assaults that it is faced with on a daily basis. And this can also continually go on to become a cancer, which is what esophageal cancers as well. So some may have either unexplained weight loss because of the reduced ability to be able to feed, or because of the fact that there's some malignancy or some cancer going on within the esophagus region. So these are, I've just walked you through some of the signs and symptoms that the patient may present with, depending on the severity or how long this has been ongoing for. And in terms of investigations, you would want to, depending on the stage, or depending on what the signs and symptoms may be, typically you would want to do an upper GI endoscopy to visualize and have a look at the esophagus. This is where a small camera is passed through the mouth, and then you are able to visualize all the mucosa or the lining of the esophagus to be able to tell. And typically you would find if there's inflammation, you'll be able to tell that there's some inflammation, there's edema, there's swelling within the esophagus, showing that it has been irritated by the acid that's regurgitated from the stomach to the esophagus. Other times you would find the ulcerations through the upper GI endoscopy. In certain times where you have the strictures, you can do something we call the barium swallow. So barium swallow would be that you would have to typically take some contrast or something that would be able to line the esophagus. Then afterwards you take some x-rays to be able to tell typically where the filling defects are. And then you would be able to diagnose.
For some people, when they eat, that's when they begin. When they eat certain types of foods, and I hope you can, I wish you could, help us with some
so
foods that trigger.
Foods,
yeah.
Sometimes fried foods.
And a lot of the fast food, right?
Yes. And then certain times even coffee, chocolates, alcohol, all of these fall within that.
I hear a lot of the spices, right? So for example, Maggi is a brand. So what do you call the generic name?
For Maggi?
Yeah. Are they spices?
Yeah, I think they are.
They're
spices, yeah.
So like a lot of the artificial spices, right? trigger these heartburns? I don't know if you hear that very commonly.
Not necessarily. Even regular spice, regular pepper, which you use as spice in certain patients, typically would trigger that. But then when you look at coffee, or when you look at fatty foods, they do contain certain components like cholecystokinin in fatty foods. That typically would cause relaxation or toning down of the strength of the lower esophageal sphincter. So it will relax it. So once something that needs to be tightened, so that once food gets into the stomach or the sac, it stays there, it's digested, then it goes forward. But then if this food causes relaxation, because of its components, it causes relaxation of this sphincter, it means that now there can be upward flow of some of the food, okay? And then it would lead to that irritation of the esophagus, and then typically with the heartburn that the patient
We see a lot
may
of
present
vomiting associated with it,
Yes,
right?
there may be some vomiting, sometimes bitter tastes in the mouth. So when it comes up, you have some sour taste or bitter taste because of the acidic component or constituents of the
How do we
gastric
know
juices.
that you are probably suffering from a heartburn and not? I hear people also say that when you have worms in your stomach, maybe we should do a topic on that. Right? Like,
Yeah, we should.
is it like actual worms? Like what like?
Yeah.
So what's the difference? Because I'm listening to you carefully, and I hear a lot of the symptoms associated with when somebody's trying to sell to me a dewormer, for example.
Yeah.
You know, so is there a relationship? Is it connected?
Yeah, so there's a difference. I mean, you having worms or some helminthic infections would come with other signs and symptoms like nausea, vomiting, depending on the day. And
Sometimes
then
lack of appetite.
Yes, lack of appetite and all that. But typically when you do have GERD, I've mentioned that you have the heartburn. You may have a little bit of nausea. But then typically you would have that belching sensation, and then that would give you that either sour or bitter taste within the mouth. And this would happen about more than twice within a week. And typically you may have started just as heartburn, but then with time, you notice that the patient may complain about the fact that now I'm unable to swallow comfortably, let's say, some solids. So I've resorted to just taking liquids. So that's when you notice that maybe they may have had heartburn, gastritis, then that gastritis esophagitis rather, then that esophagitis has led to ulcerations within the esophagus, and it has healed. And when it healed with scar tissue, and then it has led to narrowing of the esophagus. So all of these may unexplained weight loss. You know, typically as a result of maybe a gastric or the esophageal cancer forming, and then causing the typical signs of you having to have weight loss. You get it. So these are some of the things that you look at. And typically you would also check if the patient has had a dewormer in the past 3 months or not. So all of these would come in.
What does
that
that
mean?
does that mean?
Sorry?
Acidic food.
Yes, acidic foods too.
Because I realized that sometimes people eat pineapples and then they start
having that, yes.
Yeah.
So let me quickly mention that aside the relaxation of the lower esophageal sphincter, the other thing that can be the main precipitating factor is something we call hiatus hernia. So hiatus hernia is, so when you look at the anatomy of the body and the gastrointestinal system, you notice that the stomach is below the diaphragm. Okay, so typically you would have your esophagus within the chest, and then you have your diaphragm, and below the diaphragm, that is where you find your stomach. But hiatus hernia is when you have herniation of the stomach into the chest, part of it. So then it compromises the efficiency of the lower esophageal sphincter. So anytime you eat, that means that there's some part of the stomach within above and beyond the diaphragm. So that can also lead to the heartburn that you would have, because there will be regurgitation due to the compromised lower esophageal sphincter in that regard. And some of these foods too that we have mentioned typically will cause reduced gastric emptying. So that means that food that typically I would have eaten that would have easily moved into the small intestine and then gone down would stay longer within the stomach. So if it stays longer and then you have incompetent lower esophageal sphincter, the likelihood of its regurgitation is very high. So these are some of the causes, aside just the relaxed tone, and also the fact that some of these foods that you do eat have certain components that will reduce the tone of the lower esophageal sphincter, leading to the GERD that we are talking about, and then the burning sensations.
Can stress give you GERD?
Indirectly.
Okay.
In the sense that some people, when they are stressed, they tend to stress eat. So you may end up eating all these chocolates we are talking about, which have the components in there that will lead to that. You may end up, when they are stressed, may end up indulging in certain bad coping mechanisms, like taking in alcohol or whatever, which would also typically will fall within the category of foods that we have mentioned that can lead to the relaxation and then leading to what? Delayed gastric emptying, and then you would end up with the regurgitation and then the burning sensation that you would have.
So what do we do when we get it?
So when you do, usually for heartburns, you would want to tackle it from behavioral point of view, lifestyle modification, and then certain medications as well. Then, depending on the complications that may have happened, then you would want to tackle that as well. So when it comes to the lifestyle modification, it has to do with the kinds of foods that you do eat. So you would be able to associate that anytime I eat this type of food or that type of food, I tend to have it more often. So you need to avoid those foods. So those are the foods that I have mentioned: fried foods, fatty foods, greasy foods, coffee, chocolates, and all of that. So you need to reduce it as much as possible so that you don't end up triggering these heartburns. The other thing is that you can tackle it with over-the-counter medications, that is taking in some antacids. So antacids will neutralize the acids within the stomach. So it will neutralize and reduce the acid within the stomach, so that even if there is some regurgitation, it will be very minimal and you wouldn't have that burning sensation. Another medication that can be used is the PPIs, so the proton pump inhibitors. So what they do is that they typically reduce the production of the acid in the stomach. So that also will typically reduce it. And then the other lifestyle modifications being that anytime you feed or anytime you eat, do not lie down directly. You need to wait for about 2 to 3 hours, sometimes 4 hours, for gastric emptying to must have happened before you lie down. So those are some of the modifications that could happen. And if it comes to the complications related to it, it has to be done case by, because it has to be managed case by case, on case by case basis. So if it is an ulcer, then it means that you need to check typically for any H. pylori or an infection, and then you need to treat the ulcer. And then you repeat the endoscopy to make sure that the ulcer has healed. If it is a stricture that has started forming, typically when you go in for upper GI endoscopy, there are ways to be able to dilate the stricture. So there are ways where you put in some instruments to be able to dilate it, so that now it can admit some food. At certain times, you may have to put in some stents in there to be able to keep the site open so that you can have food going in. If it's a gastric, or if it is an esophageal cancer, then that has to also be staged accordingly and then managed accordingly. So we don't want to get to that stage typically, most of the time, yes. So those are some of the treatment modalities associated with it. But if it's an early onset, you need to be able to go through all these lifestyle modifications that I have mentioned, and then the use of the antacids, so that it reduces or neutralizes the acid in the stomach. Avoid these foods. Make sure you're eating healthy, balanced diet, and I think it will reduce the symptom of heartburns to a very, very minimal level.
Can someone abuse antacids? Like, so how long should I be taking antacids before I decide that no, this has gone out of hand? Let me get to the hospital.
All right. So usually antacids, you can take them about a week, sometimes 2 weeks, depending. And it can be done. You can take the antacids, and then sometimes you'll be prescribed these proton pump inhibitors. So proton pump inhibitors, 2 weeks, at least 2 weeks, and then as you are taking the 2 weeks, and then another thing I didn't mention is obesity. Okay, so obesity, when you do have a lot of fat in the abdominal region, it tends to constrict, and then it can cause you to have regurgitation as well.
I've noticed.
So weight loss.
I've noticed how obesity is a risk factor for all
Actually, everything.
every discussion
We've
maybe
had
one
here.
time we should actually look at obesity.
Just obesity.
No, so I have two
sure.
topics from this conversation.
Yeah,
Worms,
and then obesity.
and sunsuno. And that's how we call it, right? Is it, by the way, is it actually like worms in your, is it like
Oh
real
yes,
worms?
yes, you do
Real,
have
real worms,
yeah,
like
yeah. So
proper
you need to-
worms.
Yes, proper worms. I'm sure when we do have the discussion, you would see it.
Ew.
Yes, you would see. You
and
see
we also
that.
have to look at obesity.
Obesity
you know.
in its sense, yes. So that's typically, you need to be able to also have some lifestyle modifications to be able to lose weight.
Right.
So when you lose weight, it reduces the fat component within the abdominal region, and that doesn't constrict and then cause the regurgitation of the stomach contents into the esophagus, typically giving you the heartburns that comes with GERD. So these are some of the things. But antacids, as you mentioned, if you are taking it the way you should take it, I don't think that you would abuse it. But we don't want people taking the whole bottle and then, drink it. No. So you'd have to take it if it's twice, morning and then your evening dose. That should do.
Someone says the core of a cabbage can help with, acid reflux. How
Okay.
true is that?
I haven't heard about that, but it's possible if it does contain certain components that reduces the acid production.
Okay.
Or it doesn't contain any of these components that reduces the laxity or the tightness of the lower esophageal sphincter. So once it has that criteria, then you can see. And typically all vegetables would help because they don't contain any of these things that I have mentioned. And typically they would help with rather improve digestion and then improve the peristalsis of the whole GIT system, so that you would have food emptying from the stomach all the way into the other parts of the gastrointestinal system. So that is what it is.
Interesting.
Yeah. So heartburn, yes, is common, and people would come in and then mention it. Especially, what I wanted us to be able to differentiate is the heartburn, which is coming from the gastrointestinal system, and then when you have tightness, which is more serious, and which is coming from cardiac. Okay, which I mentioned from the beginning.
It's not fatal, right?
Which one? The heartburn.
Heartburn.
So it's not fatal from the beginning, but if you do wait and you do nothing about
It gets complicated.
and then it gets complicated, it may become fatal.
You did it-
Especially when you are dealing with the fact that now you have a stricture, and then now you end up with what? A cancer. That may become fatal.
You didn't mention that gluttony is part of the causes for heartburns. Sometimes you go to a party.
People overeating.
Like what?
There's an abundance, so they're eating,
No.
chopping left, right,
And
center.
the painful thing is that sometimes they don't even finish the plate.
Yeah.
They will leave it and go and
Get another
Something
one.
else.
they eat like their life depends on it. Gluten
Yeah,
is a
yeah.
spirit.
So overeating, yes. Overeating, meaning that you're going to keep stretching the stomach, and if it can't contain it, and there's relaxation of the upper esophageal sphincter, you end up with regurgitation.
On the
and
overeating
heartburn.
bit, will you say also the reverse is true, right? Where malnourishment or under-eating, for example, would also cause similar problems?
No, it shouldn't. I mean, you not eating should not cause that. Rather, it should rather cause maybe you would have a lot of acid in there, and then the acid is either used or is not used. But it would typically not cause regurgitation into the esophagus, as typically it would be in, yes, overeating or
Interesting.
overindulging.
All right, Doc. Thank you so much.
too.
I've learned a lot, and I'm sure our viewers have too. And so once again, thank you so much.
Most welcome.
All right, let's